We're seeing the onset of AIDS, and it's alarming. It's alarming to see people that I personally have worked with for many years getting thinner and thinner and booking off sick, and sometimes coming back for a while and sometimes not coming back at all. And we've realized that the pandemic is taking a hold on our workforce.
I would say over the last year, we could have easily lost about 12, 14 people, all in all. And we need to train, we need to replace those people. It's a lengthy program, costly program. There's also the human side to it.
It's going to be catastrophic. I mean, if you train people, especially the young people now, and they work for 2 or 3 or 4 years and they're gone, you have to restart all over again. So you can imagine what economy, what it will do on your company.
Top management are responsible for ensuring that we have effective corporate governance, that we have sustainability of our operations, that we mitigate any risks to the business itself. And from that perspective, it is critical that they are involved in any program that we put in place to try and address HIV AIDS and its related impacts on the business.
Walvis-based stevedoring, a typical medium-sized Namibian enterprise.
We see that people don't turn up for work, they fall ill, stay away for months, maybe don't come back at all. And it's not only unskilled people, it's also people that are in key positions.
The story is not unusual. Across Namibia, companies are facing the rising costs of AIDS. Increased absenteeism, loss of staff, loss of skills and experience, declining morale, increased training costs, and increased medical costs.
We see now how many people go out of the system lately, how many people we have to identify and train and appoint again, spend money on that. Because as quick as you can train people and get them to the top, you know, some of them can actually go out of the system again. If we look at 5 years from now, if nothing is being done in the company about AIDS, the affirmative action plan and the AIDS infection, I mean, the result can be nil at the end of the day.
Like it or not, we are all going to be affected by AIDS. As deaths increase, gross domestic product will rise more slowly. According to the National Planning Commission, estimates from the region show that every AIDS-related death removes an average of 14 productive years from the economy. AIDS deaths in Namibia will rise from around 12,000 in 2001 to over 23,000 in 2006. More than 100,000 deaths in 5 years, costing over 23 billion Namibian dollars in lost working years. But what does that mean for individual companies?
I think a company would first of all need to do an internal assessment. It needs to look at itself as a company and see, you know, who is infected in the company. Because right now when you talk of infection rates of HIV/AIDS, we are taking the national prevalence rates, and which, I mean, don't tell us very much because they are not specific to companies. Therefore, a company needs to know itself as to who is being affected by HIV/AIDS. It needs to know, like, people, I mean, how the trend for the sick leaves, how many people are taking sick leave, and how much it's already beginning to affect the company. And in terms of training, what kind of costs are being incurred in training people. Those kind of things the company needs to look at. It needs to do an internal assessment, look within itself, institutional audit we can call it as well. It needs to do that. It needs to probably then think of having some kind of policy in place, an HIV/AIDS policy in place. And then beyond that, we need then to determine as to whether we are now going to have a comprehensive program, whether we're going to band up with other companies, because what we could also be looking at is probably in different sectors, seeing how we can collaborate, partnerships, in order to be able to plan for this whole disease.
This film is going to show how AIDS can be managed in the workplace. We're going to look at the mining sector, where programs have been developed that will benefit companies across Namibia. We'll look at a survey on the attitudes of companies to HIV and AIDS. We'll follow policy development in Walvis Bay. And we'll be examining a major service provider. Nampower is taking action now because when the lights go out, everybody else is affected. Most importantly, we'll look at how large companies can assist smaller ones to fight AIDS in the workplace. But our journey starts here at Ausencare Grape Farms on the Orange River. It's the largest agricultural investment underway in Namibia, growing high-quality table grapes for export. But in the international market, competition is tough. Namibia is competitive largely because wages are low. To keep prices down, the farms are reluctant to provide workers housing and other benefits. When it comes to spending on AIDS programs, Ausencare says it doesn't have the money.
You've got a certain budget and you cannot overstep that mark. It will not be in my and also to the company's interest. You see, we're in this business to make money, to make a profit. And we must make it lucrative, and it must be done in such a way that we can get investors also to come and invest so that we can provide work for these people. So our priority now is to get work for our people.
There are 5,000 people employed during the harvest season in the most labour-intensive business in Namibia. With their families, 14,000 people live and work here. There's no AIDS education and deaths are commonplace.
Last year it was horrendous. We had about 9 deaths from babies in 1 week. Last year was really bad. This year we only had about 6 deaths that can be associated maybe with AIDS. Of course, I do not have the figures.
Without statistics, managers can't know how many deaths are due to AIDS. Ausencare Farms used to transport the dead home for burial, but the costs proved too high.
That became a problem, especially last year when we had a lot of cases, a lot of deaths. On average about three a month. And from here to Katima Molelo, you talk about $12,000 to $13,000 Namibian dollars to transport the body up there. So it's a big problem.
With those costs, an AIDS prevention policy might seem a worthwhile investment. There are 9 companies growing grapes on the Orange River. The vines come first, social infrastructure second. The workers build their own huts from reeds found by the riverside. 6 of the smaller companies, under the umbrella of Ausencare Grape Farms, have built a school and a clinic, but the largest employers see no need to invest in health facilities. The clinic remains empty, unused.
So here's the clinic.
Sister Ullman is the Karasburg Regional AIDS Counsellor of the Ministry of Health and Social Services.
See, this door is broken now. It was supposed to be the nurse's home.
Ausencare Grape Farms built the clinic and the government agreed to staff it. The nearest state facility is 60 kilometres away at Noorduva. The clinic is desperately needed and Sister Ullman wants to see it operational.
There's a great need for this clinic.
So the Karasburg Hospital outreach team is only coming twice a month to render preventative services, weighing the kids, doing family planning and antenatal care, giving antenatal care. But I think it's not sufficient because we're having such a lot of people here, and we always have these kids dying of diarrhea and the adults dying of these AIDS-related diseases. And I think if this clinic can function now, these deaths can really be minimized. So, but that's what we are having here now.
Not all of the companies are willing to invest in a clinic, and the government has now asked for 3-bedroom houses to be provided for the nurses.
We had a commitment from the government that we will put the clinic there, the building, then they will start the clinic, they will give the nurses. And then somewhere along the line, a new problem started. They looked for housing for the nurses, and they're not prepared to build 2 houses for 2 nurses. We have to do that. At this stage, there's a couple of companies in the area, and only half of that companies are really contributing to the clinic. So this is why the clinic is still empty.
While the dispute about nurses' housing goes on, 14,000 people are without the most basic health care. Sister Allman visits when she can and gives advice about protection from HIV under a tree. House and Care's manager takes the common view that health is the government's responsibility and it should provide HIV/AIDS programs.
I think the government should pay for it. In every country that's got a problem like that, I think the government, this is, especially in this area, it's private investors. It's not big companies that invested here, it's more private investors. So they've got a limit on their budgets. So I think it's the government that should really come forward and spend money and start the programs.
Sister Allman competes with Tombow and cards to get the message across. With no organised awareness programme, it's hard to maintain interest.
There are only 3 ways. Let's pay attention, please. Yeah. Since you said that you don't know anything, I think it's very important to listen carefully so you know what is AIDS all about.
The Chamber of Mines has started a programme at nearby Rosh Pinar mine. House and Care was also interested, but thought the cost was too high. If the company doesn't take the issue seriously, the workers won't either. The decision to invest in awareness programs will have to be taken sooner or later.
If you look at it that way, the same as you spray your grapes, you have to spray them, otherwise you won't have a product to export. So maybe in the future with your budget, every year you'll have to bring that in your budget and say, listen, this is a necessary, otherwise we won't have any people to prepare the crops. So, but at this stage I really can't see the light in the tunnel, especially on the money side, for paying for these programs from the investors, from the company side.
"250 kilometres along the Orange River from Ausenkere lies Oranjemund. Here, key foundations were laid for Namibia's response to the AIDS pandemic. The Oranjemund Health Education Programme, OHEP for short, targets the entire community, as well as the workforce. The emphasis is on health, not just HIV and AIDS.
We don't want the project to be stigmatized. We don't want people thinking that the Oranjemund Health Education Project is an AIDS project. We want them to know that as important as it is to know your HIV status, at the same time you need to live a positive and healthy lifestyle. So we need to promote health in general so that people do not stigmatize the project and at the same time remember to take entire responsibility for their health.
Namdeb saw the warning light as far back as 1989, when the OHEP programme began. The stigma of AIDS means employees are unlikely to go for an HIV test or to tell an employer if they are positive. To find out the infection rate, Namdeb commissioned an anonymous saliva test in October 2000. The survey showed that 7% of those tested were HIV positive. Why does Namdeb believe its infection rate is much lower than the national average?
Well, we'd basically like to assume that it might have something to do with our HIV initiatives over the past 12 years or 13 years. Namdeb embarked upon the Oranje Health Education Project in 1989, and this project focuses mainly on education, counseling and training. These are the 3 areas of focus, and through creating awareness on HIV/AIDS issues, we believe that people better understand the HIV/AIDS epidemic, and in that way they were able to take responsibility for their own health and perhaps prevent the quick spread of the epidemic within their Namdeb workforce.
It's people like Emily Shehepo who get the message across to their fellow workers. Emily works at the security gate controlling access to the town, but she's also a peer educator.
Association of TB and HIV and AIDS.
Peer educators learn about health, AIDS and related illnesses like TB from qualified trainers, usually nurses. If they can get the information across to their fellow employees, there is also a good chance that they will take the message home to the family. Emily's commitment doesn't stop there.
Except for condoms for your end, and then I'm going to break. No condoms.
She gives up her evenings to give advice to domestic workers who also live in the town. It's her own initiative, but Emily's evening activities are a practical example of OHEP reaching out into the community.
I was trained as a peer educator since 1996, and we were just trained to help the employees only. I find out we are not including the domestics in. Then I decide out of my blue, that I want to talk to them and see what really they need, and do they really understand about this HIV/AIDS and other different kind of diseases.
The OHEP program targets the whole of Oranje, not just Namdeb employees. Women are especially important. They need to know the facts about HIV and AIDS, not the myths. And they need to know how to protect themselves. From the start of the working day, AIDS is integrated into all of Namdeb's operations in a project called Elua to minimize the impact of AIDS on the workforce and the company's profitability. Key elements are communication to promote understanding about HIV and AIDS, saving lives and limiting the spread of the disease, financial models to assess the costs of AIDS, living positively, and monitoring indicators like sexually transmitted diseases and condom use. For Namdeb's management, health and business go together.
I think the project Elua, which is a new dawn in Noshubambo, is really a way of integrating those initiatives and these impact management into their business, because we came to a realization that it's not only a health issue, it's a business issue, and it had to be managed in the business environment.
Namdeb's best practice includes the Mine Workers Union, which is fully behind the company in its determination to fight AIDS in the workplace.
This is not an issue of opposing one another. It's an issue of working together as partners. As I'm saying, the disease is affecting people left, right, and center. Irrespective of your color or whatever your position in the company, you might be a general manager. But if you make yourself vulnerable to that one, you just die like a person who is a cleaner. So there's no difference. So they should just work together as a team.
Okarusu Fluorspar Mine near Otjiwarongo. In 1999, the Chamber of Mines launched OHEP, the Occupational Health, Education and Awareness Programme, with the sponsorship of Okurusu Mine. OHIP extends the Namdeb philosophy to the whole of the mining sector, where infection rates are thought to be high.
There's no doubt in my mind that the mining industry will be, if not devastated, badly affected by the crisis. And that any manager who's serious about his job, who's serious about productivity and serious about having a happy, productive, creative workforce has to consider the OHIP program, has to consider an HIV policy, has to consider what its management team should be doing to prevent the spread.
How do the people respond if you start talking about sex? Hoe reageer die persone as jy oor seks praat?
Simone Shehepo runs the OHIP program for the Chamber of Mines. She trained Okurusu's peer educators.
You know, when you are talking about sex, they want to listen.
It's more than an AIDS awareness program. As at Namdeb, the emphasis is on health.
In the OHIP program, we don't only look at teaching or training in basic facts on HIV/AIDS. We go beyond that. What we do is teaching issues like self-awareness and communication skills. And with communication skills, we add presentation skills and all different forms of health education to make it so comfortable for the peer educator to go and train it so informally that everybody understands and responds, and that both parties actually enjoy doing this whole exercise. Peer education means educating a person on his own level. Okay? And if we look at peer education, or if we educate on either people of the same age group or the same grade or the same status. In the workplace situation, we would look at educating peer educators so that they can be able to educate the worker on their level.
This session is on sexually transmitted diseases. The illustrations are graphic, the discussion practical. The peer educators have learned that fellow workers with STDs and genital ulcers are 15 times more likely to become infected with HIV. Evaluation of the sessions is a key part of the peer education process. Whenever Simone visits, she takes notes for discussion later. Inevitably, there are pressures to get the men back to work. Production is the priority. Simone takes up this issue in the appraisal. What time should the peer education session take place?
Don't you think we can change their time as well and rather do it early morning like this because it's working here, than taking them off 30 minutes before knock-off time because that time they are really tired.
The mines have always allocated time to safety. Now, the emphasis has shifted to include AIDS. Okurusu's management will listen to suggestions from peer educators because they have a direct impact on business.
We've seen at least 2 to 3 of our employees that we've sent off on intensive training courses that we've actually invested a lot of money in have contracted HIV and subsequently AIDS, and we've lost a couple of individuals already that we've invested a lot of money in. Quite apart from the fact that you've had the tragic loss of one of your workforce, you see the effect on productivity because you no longer have the skills to run the mine. If you're in a situation where the skills are readily available, it wouldn't affect the mine and its operational efficiency as much as it does. But in this particular country, the skills are not available. There's a shortage of skills, and you suffer accordingly.
Okurusu's program is founded on an HIV/AIDS policy based on key principles. Non-discrimination. No worker will be discriminated against in terms of employment, promotion or benefits. And HIV/AIDS as a workplace issue. No aspect of Okurusu's operation may be discussed without reference to HIV and AIDS and the impact of the pandemic on the business. The employees benefit too. They know that Okarusu will not dismiss them if they are HIV positive, and workplace education has an effect on the family as well. For most of the year, Albertina Shikongo looks after the family farm, while her husband Martin works at the mine. When he comes home, there's a great deal to talk about. As more and more people are dying from the new disease, the issues of separation and sex are no longer taboo in the north. Although OHIP was designed for the mining industry, the program is available to any company or institution for an annual fee.
It's for industry in general. So far we've got the municipalities, we've got Tsumeb municipality that we also went through the awareness programs of OHIP. We've got Walvis Bay municipality that is fully on the OHIP program, and then we've got fishing companies in Lutritz as well. We've got the Hansa breweries in Swakopmund that also went through the program. So it's open to all interested companies.
In 2001, the Namibian Chamber of Commerce and Industry commissioned NEPRU to make a national survey to assess the attitudes of business to HIV and AIDS. The survey included Walvis Bay.
You found that generally companies were not doing anything about HIV/AIDS. You found the bigger ones like the NAMDEBs, the NamPower, some of the commercial banks. They were doing, or they were more active in the HIV/AIDS area. But when you came now to the other smaller ones, which are represented throughout the country, then you found that they were actually not doing anything about HIV/AIDS.
The survey team targeted small and medium-sized companies and asked managers whether their business would be affected by AIDS.
The people is going on they're taking leave for funerals, for sickness due to HIV/AIDS.
When you're trying to find a new employee because of someone is taken out of the business because of AIDS infection, I mean, that's a severe blow.
Product-wise, we won't be affected, but if you look at the people, yes, we have personnel, so they will be affected. But the business as such, I don't think, because tires can't be getting AIDS or something.
Walvis Bay is Namibia's key industrial town, with a cross-section of large, medium and small enterprises. 53% of businesses saw AIDS as a threat, but only 30% had any kind of program in place. NEPRU was interested to see whether managers were making the connection between HIV/AIDS programs and productivity.
When you do ask some of the company managers and you talk to them, like I did in some cases, and say, if your employees get sick right now and you can't replace them, then it's going to affect your profitability. And they say, oh, how is that going to happen? So I simply tell them that, the employee will not be able to do the work anymore. They'll become sluggish, sick leave and whatnot, and therefore who will do the work? Then they say, oh yes, well, maybe it's an issue we should be thinking about, but how do we start? Because we don't know how to start. We don't know where to go to. Ministry of Health is not providing us with any information. So there's still that whole problem of Ministry of Health being seen as the answer to the problems for HIV/AIDS, which cannot work.
The message from NEPRU is that companies have to take responsibility for the issue, not government. It's a message that the Ministry of Health is keen to support.
Our approach is that for you to own the program, to own the activities, it should involve the managers. First of all, to give leadership. We do not wish a situation to arise or the impression to be created that it is the Ministry of Health which is coming to implement a program in their workplace, because that will not guarantee success. Success will be guaranteed if they are participating fully and if they are involved themselves.
Companies are starting to plan for a future with AIDS. Walvis Bay stevedoring is part of the Manica Group, which does have the resources to do something. They have made a start by inviting a South African consultancy to help managers assess the impact of AIDS-related absenteeism.
The first thing that I want to check with you then is it a good idea for high-profile people to divulge their HIV status? Does it mean anything for us in companies? Do you think it is?
GJ Stemmett's training starts from the assumption that managers should give a lead in everything, even to the point of revealing their HIV status. Manica is investing in management training to stay competitive. Having an idea of the number of infections in the company will help it to design a prevention program and to plan a succession policy for the replacement of key employees as they fall sick.
We've already started planning. We've decided that, we will need foremen and supervisors. We must train before there is a shortage, because we cannot let our customer service go down due to that. It's a very competitive market, and it's not just locally, it's not just between stevedoring companies, it's between ports. It's the Port of Cape Town and it's the Port of Walvis Bay. We need to stay competitive, we need to have trained people.
Manica is not the only company that has started to take action. Hangana Fishing is part of the Oldhaver and List group. Loss of experience is having an impact on production.
So far this year, we already had a few losses due to AIDS, HIV/AIDS, and one example is an engineer on one of our vessels that passed away due to AIDS, and then just recently we lost a forklift driver. And especially with an engineer, it's a long-term training that the person requires to be able to be an engineer on a vessel.
Hangana is hoping that a workplace education program will save them money in the long run. And if the message is carried home to families, there will be social as well as economic benefits. Once a month, Hangana's workers have an AIDS awareness session. The idea is to reduce myths and fears about HIV and AIDS. Time and again, the same questions are asked. Where does AIDS come from, and is there a cure? Today, an HIV-positive person has come to answer questions. The monthly AIDS awareness sessions are a local initiative. They are organised by the Walvis Bay Multi-Purpose Centre. The centre runs a peer education course for unemployed young people who are learning how to train peer educators in industry.
Peer educator being a good role model, right? We've talked about that before. Okay, give me another question.
Companies in Walvis Bay will want to know if the training will be a worthwhile investment. Today's awareness sessions are run by volunteers and cost only $200. But tomorrow's peer education will cost a great deal more. Will companies pay?
But it's definitely worth in investing that kind of money and that time in preparing the people and making the people aware of HIV/AIDS and the effect of it. Therefore, from this at this stage, the program has only started sort of middle of the year, being very intensive, but it's definitely going to have a good payback for the company end of the day.
Managers are realising that AIDS programs are an investment that will save on training costs. But before a company starts a program, it should have an HIV/AIDS policy to provide a framework for action. Walvis Bay Municipality has adopted a policy that will act as a guideline for its employee assistance program. The policy was developed for the municipality by the AIDS Law Unit of the Legal Assistance Centre in Windhoek.
What we did with the Walvis Bay Municipality, and it's pretty much the same procedure that we follow with most organisations and companies, is to firstly address management, top and middle management, on the need for an HIV policy in the workplace.
The draft policy was discussed and amended in detail by the municipality's management to suit its own circumstances. Discrimination was the core issue.
I would just like to know, how will we ensure that employees with AIDS will not be discriminated against? How are we going to make sure that that will not happen?
Yes, if I could come in there, I think...
The one sort of part of the policy that is fairly standard is the part that deals with the need for non-discrimination. And the second one is the need to to have a policy that creates a framework for putting a good program in place in the workplace. I mean, there's no point in having a policy if there's no program that follows on from it. And the policy, I think, is necessary to create the framework for that program.
The AIDS Law Unit doesn't provide off-the-shelf policies. Managers need to discuss and amend a policy in order to own it and to be able to provide leadership in the implementation of a subsequent HIV/AIDS program.
If we don't have leadership incorporated in the policy, it will be a failure from the very beginning. And that is why we've tried to commit the councillors. We've committed the general managers in the planning process and in the monitoring process, as well as all managers in the activities of the policy.
Once the policy has been agreed, it should be communicated to all the workforce.
The promotion of non-discriminatory, supportive and sensitive attitudes towards people living with HIV and AIDS.
This isn't a one-off process. Employees should have the chance to discuss the policy and ask questions, so that they fully understand that it is there to help and protect them. By devising a policy and implementing an employee assistance program, Walvis Bay Municipality is following the guidelines of the National Code on HIV and AIDS in Employment. The Code recommends communication of the policy to all concerned, monitoring of the policy's effectiveness, education about HIV and AIDS, protection against victimization, job security, and no discrimination regarding medical and retirement benefits. Once a company has a policy and program up and running, it has to be constantly evaluated to see if it is working. The turbines at Ruakana Power Station are deep underground. Nampower has 800 employees, many of them highly skilled. An anonymous survey recently revealed that 14% are HIV positive. Nampower is a key industry for Namibian business, like Namwater and Telecom. Without telecommunications, water and power, industry would grind to a halt. Nampower knows that it is losing skilled technicians, and it has to plan for a business environment with AIDS.
The biggest concern with the issue of HIV/AIDS is that there's no way of knowing exactly who is positive, and yet you have to ensure the sustainability of your operation. This means that every employer is then required to have a succession plan in which you identify your critical positions within the business, and you have to ensure that you train up more than one potential successor.
Nampower launched an internal audit to find out whether its program was meeting its policy objectives. It reached 3 important conclusions. Firstly, the succession planning program had not been implemented, and skills in critical positions could be lost due to AIDS. Furthermore, supervisors were not giving sufficient backing to the peer education program.
The program was not receiving adequate support from the supervisors, and when we investigated this, the conclusion was that in many respects, I think the attitude of the supervisors is that of the ordinary man, and that is, it cannot happen to me.
Thirdly, the program was stagnating. There was no momentum behind it or mechanisms to measure its effectiveness. There's been an AIDS awareness program at Nampower since 1996, but the peer educators were losing interest. Nampower wanted to find out where the problem lay. Daniel Lowe is the company's health and safety manager. He monitors the program by talking to peer educators about practical issues, like the time of the education sessions.
Some of the people are just there because they have to be there. Most of the time when they have to give these decisions, like the shift guys, is when the other shift is knocking off and another shift is coming in. So the other people, they want to go home, so they are just there listening for the peer educator to finish his story so that they can go home.
If your peers don't participate in this program, then it will fail. Then we will be where we were last time.
Nampower knows there are problems and has brought in an NGO to assist in a revamped program.
To be honest, I don't think it's working very well at this stage. I've requested AIDS Care Trust, who did a training for us, to sit in on peer educator sessions and to assist employees. I think the problem now is with self-confidence and with the presentation skills, or the skills to convey the message to their peers. And I think we're busy working, we want to work on that one.
The AIDS Care Trust specialises in workplace education programmes and has provided training for NamWater, the Ministry of Works and Standard Bank. Their job is to monitor the programme and improve the skills of the peer educators.
The service that we provide at the moment is training of peer educators, ensuring that the program runs. We monitor this program to see to it that it is effective. We then also visit them when they do some of these discussions so that we can see to it that things are actually running at the operational level, if you like, so that when the peer is discussing it with his peers, we are there, we assist them in that regard so that they can make sure that the program is effective. So that is what we are doing at the moment. We are also, of course, planning to again get these peer educators back together so that we can give them more. I mean, things are changing, so we need to make sure that the program is continuously running effectively.
But an outside NGO can only assist. It's the company which must provide the time and resources for the education program.
It is important to have the involvement of management in place, because they would ensure that time is allocated to do this program. That's why the involvement of management is of utmost importance.
Now it's the responsibility of top management to make sure the revamped program works and that supervisors are fully behind it. If they are not, they will feel it in their pay packet.
You get scored. Your entire performance for how you've performed your job, it now becomes part of your job if it's included in your performance agreement. There'll be a weighting attached to it. You'll get scored and assessed on the back of this. And your annual increase, since we intend to have a link between pay and performance, will be determined on how well you have supported the wellness program. So it is one of the factors that will determine your annual increase going forward.
Good morning.
In November 2001, the NCCI hosted the first breakfast meeting for Namibian business on the theme of HIV and AIDS. It's an idea which has worked well in other southern African countries. In Botswana, which has the highest AIDS rate in the world, business has come together to form an AIDS coalition, which informs its members about the cost of AIDS and strategies for coping. The introductory remarks were made by NAMDEB's Managing Director, Inga Zamwani.
It's indeed a very historic moment because as far as I can remember, this is the first time that the private sector is meeting together to share experiences, ideas, learn about regional as well as global trends on this very important subject. Many of us are still living in denial, either saying our workforce is not affected or government must provide the lead in the fight against HIV. Therefore, few of us have taken adequate steps to manage the epidemic comprehensively. Few Namibian businesses have gone so far as considering the cost of providing antiretroviral therapy and other wellness programs, and therefore budget accordingly.
The lights were dimmed for a presentation by Charles Parsons, representing Calibre Clinical Solutions, a South African company offering therapy.
To understand this disease and how to manage this disease,
Business breakfasts are an ideal opportunity to introduce controversial issues, and there is none more controversial than antiretroviral therapy.
because hopefully if you understand what this disease is about, you'll understand how to manage it and why it's crucial to use, as the chair lady said, antiretroviral therapy. How do we introduce it? Is it cost effective? Can we use it? And how does this change the whole future of this disease for your country?
Wealthy companies like Namibia are considering the introduction of antiretroviral therapy for HIV-positive employees.
Yes, it's something that we are looking at. I think the scientific evidence currently are indicating to the fact that they can be effective if they are properly managed. Their prices has been coming down tremendously. We have a discussion with some of the manufacturers, GlaxoSmithKline, who have agreed that we can participate in their access initiative at obtaining these drugs at a reduced rate.
Namibia has its own medical services and is big enough to negotiate with drug companies. The government has not intervened to cut the cost of antiretrovirals, so providing therapy is a big decision for a company, and cost is only one factor.
Yes, I think the first thing which the company should do is to ensure that the workforce, they have got a medical aid. That will be much more easier for a company, rather than to wait that the company would pay for individual person who is going to get treatment. The drugs, they are very expensive and they are lifelong. In other words, you cannot say that I start treatment only for 6 months and then stop. Once you start, you must make sure that you carry on giving that treatment until the demise of that particular individual.
There's also the question of who within a company do you provide antiretrovirals to? Do you only provide it to the people who cost more to train, or do you provide it to everybody? Now, from a human rights perspective, if you're going to provide it, you've got to provide it across the board, without discrimination in terms of who holds what position. In terms of what happens when you leave the company, I don't think that anyone can seek to argue that a company would be compelled to carry on providing antiretrovirals for the rest of a person's life if they chose to leave the employment of that particular employer. But for as long as people are employed in that particular employment situation, I think it makes economic sense.
Businesses may be impressed by arguments in favour of therapy, but there are snags, like the toxicity of the drugs. Simone Shehepo believes that therapy alone is not the answer.
No, it's not the best way. Or it's not the only way, I would say, because therapy without the necessary information and the counseling and without a positive lifestyle does not help. You cannot go on drug therapy and continue drinking, continue smoking heavily and continue sleeping around without a condom. Then it's useless. So it's not the best way. Therapy alone, it's not the best way. You've got to have it along with your counseling and your supportive systems.
The breakfast meeting was more than a forum to discuss therapy. The main focus was NEPRU's survey of Namibian business attitudes carried out for the NCCI. Hoppelang Faroro introduced the possibility of large companies helping small ones to develop programs, a network to combat HIV and AIDS.
I believe forming alliances and partnerships with the government and other institutions is probably the best or most effective way to go about it, because when you look at some of the companies in the private sector, they are too small to do anything on their own. Therefore, maybe what they need to do is to work with the government, other institutions, maybe also other private sector companies who are already starting or who have already got programs in place to work with these smaller ones which might be in their same sectors.
Rossing Mine has had a highly successful health education program that has included smaller businesses. In 1989, the mine decided to extend the program to the town of Swakopmund by inviting businesses to send employees to join the mine's peer education program.
We were looking at various target groups and thinking where we could really start adding value. And then we basically approached the businesses, and those who showed interest in the end, we trained the people as peer educators.
Although the initiative started well, it was difficult to sustain, and it collapsed when Rossing left the shops to continue alone. But Pick n Pay's present manager sees the need for AIDS education to start again.
Look, I've seen a lot of people going to Oshakati or to other places for funerals or Windhoek or whatever. It's something that happens monthly. It's at least one staff that goes away for a funeral once a month, at least.
Large companies have the resources, human and financial, to help smaller ones. But Rossing is not prepared to help again unless the other businesses show full commitment.
What we as Rossing want to do is to really motivate people to start with these programs. And that is why we really invite people to training, and we are even willing to pay for that training as we have done in the past. So the cost as such is not a problem. We just need someone within the company to take the program forward, to really drive it within the company. That is all that is needed.
The Walvis Bay municipality is also ready to help local industry. Atlantic Meat Market is a medium-sized enterprise which lacks the resources of a large corporation. It needs help with an HIV/AIDS prevention program.
We've had Atlantic Meat Market approach us. They got quite a number of employees, and they've also approached us to give specifically health education on HIV/AIDS issues. We are at this present moment busy with the development of the internal process of the HIV/AIDS policy, but most definitely we would like to go external as well. That is the big aim. I think we're now at the stage where we are ready to go out and assist this kind of request.
It's an excellent example because Walvis Bay municipality is very important to the country since it's Walvis Bay, it's EPZ, and it deals with the whole town's health. So I think they should take the lead, and that is what they are doing at the moment. They've already given me permission to give their policy to other companies that requested for it. So it's not only applicable to other municipalities, but even other companies are using it at the moment to set up their own structures.
Attitudes are changing. Back in the south of Namibia, Ausencare grape farms are also looking for ways to start an AIDS program, investing in human resources as well as new cultivars.
I think from the company side, we could also be prepared to get our staff involved in these programs with these people. Like one of the necessary, what you have to do in preparing the crop, we will say this is one of the necessary things for the year that they have to attend.
There's already a peer education program starting up at nearby Rosh Pinar mine. Combining that with peer education at Ausencare should be a simple matter, according to Simone Shehepo.
The best way is a combined training program because they are a farming community and Rosh Pinar is a mining community, but there's a lot of similar conditions if you look at the Rosh Pinar, the squatters that are staying there. So they can link up in terms of training programs and community projects, and then they can go back and implement the same things in their own community.
The cost of a program could be split between Roche Pinar, Scorpion and the grape farms. Außencare's manager would like the Ministry of Health to be involved. But whoever provides the training, he knows the farms will have to contribute to the cost.
I think a 50-50% will be a good thing. 50% from the company, 50% from them. Costs, training the people. So I think it will be a pillar in the south of Namibia if we can start that, and the sooner the better.
Starting now will save money later. That's the simple message from economists and businesses that have made HIV/AIDS impact assessments. Studies on best practices in the region have shown that the cost of medical benefits and training and the loss of skills and experience can outweigh the costs of HIV/AIDS programs by 3 to 7 times.
Spending on HIV/AIDS is an investment because it costs more for the company not to do anything. Therefore, like if, for example, a company decides that it's not going to do anything about HIV/AIDS, now it's going to fold its arms and let someone do it, then by the time they decide they want to do something, already their staff members are already infected, and you get into all other kinds of costs which the company is going to incur. So it would be better for them to start investing in it before staff members start getting employed, or at these early stages, so that it prevents any more, or let me say it prevents the disease from worsening. Therefore, in the long run, it's better to do something now than 5 years down the road.